Welcome to The Real News. I'm Mark Steiner. Good to have you with us. We here at Real News, even if we have to work remotely, will be bringing you the analysis and understanding of what you need to know as we confront the potential of this worldwide pandemic of a coronavirus. Last night's primetime address by Trump was less than inspiring, to say the least. Contradicting his blasé approach to the COVID-19 crisis over the last few weeks, and still bringing us a series of untruths in a stilted speech he obviously did not read or practice before he went on the air.
This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens, and we will ultimately and expeditiously defeat this virus. Taking early, intense action, we have seen dramatically fewer cases of the virus in the United States than are now present in Europe. The European Union failed to take the same precautions and restrict travel from China and other hotspots to keep new cases from entering our shores. We will be suspending all travel from Europe to the United States for the next 30 days. These restrictions will also not apply to the United Kingdom. Testing capabilities are expanding rapidly day by day. We are moving very quickly.
Well, Trump did not tell us the truth. Our country is not on top of this looming pandemic. South Korea has been testing 10,000 people a day. We've tested maybe 8,000. Some say less than that. Researchers in Seattle are illegally testing swabs from a flu research project because the United States government would not allow them to move ahead with the testing. Italy, being on lockdown, is part of the answer. Countries with national healthcare systems are much more prepared than we are to respond to this crisis. Europe is actually ahead of us, not behind us in their response.
There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. WHO has been assessing this outbreak around the clock. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do.
So as the World Health Organization says, we are in the midst of a worldwide pandemic. And Trump's travel ban on Europe is not the answer. It may only exacerbate the issue, some say. He said we were ending trade and cargo from Europe. That's not the case. Spokespeople from the healthcare industry contradicted what Trump said about waiving all co-payments for treatment. What he never talked about was how we will take care of the under and uninsured, or the fact that we have only 100,000 intensive care beds in the United States and they're filled. What he didn't talk about was what happens to the workers who have no paid leave, no job support. What will our government do to help them? We at The Real News will be covering all of that. The insanity of the politics of Trump is one issue, but more importantly, we will be bringing you the kind of coverage that allows all of us to understand what's happening around us. How the destruction of habitat and climate change are unleashing these viruses. How this coronavirus compares to others throughout the centuries. And we'll be talking with health experts from across the world to keep all of us abreast of what we need to know. We may be producing all of this remotely, as we, like everyone else, may be forced to work from home. So thank you very much for joining us. We'll do our best to bring you the information and news that you need in the coming weeks. So be in touch. I'm Mark Steiner of The Real News Network. Take care.